Moving on, our next presenter, Dr. Zeeshan Mansuri. I'm assuming if you are on social media, you know about him. I mean, he is one of the best proponents for IMGs. And for those of you who may be living under a rock, don't know about him, he's a chief fellow child and adolescent psychiatry at Boston Children's Hospital, one of the most competitive programs ever. And he had a different passion. He was always passionate about psychiatry. And he's going to talk about the evolving trends that he has seen over the years and how some specialties like psychiatry have become the new dermatology. So the evolving trends, especially with a focus on psychiatry. So welcome, Dr. Mansuri.
Thank you, Pawan, for giving me this opportunity, and glad to see that 156 people are in attendance on a Sunday. So I think I'll just share my screen, and I hope my internet is good because I'm at my sister's place helping her move. And okay, so let me minimize. Can you see my screen?
Yes.
Okay, perfect. Let me minimize this. So just a heads up, we have some guests in the other room, including a 17-month-old. So if you hear some shouting or some crying, I'm sorry. But I'll hope that he will not do that. So I was thinking of initially talking about like comparing psychiatry to plastic surgery and stuff, but I guess that would not be too helpful at this stage. So I'm just going to talk about lessons from my journey, and which will help all our applicants. So disclosures, I try hard every year, even after reaching Harvard, but this slide never changes. There are no disclosures yet. So when you come to US, I think the biggest problem is there are too many mentors available here who just keep giving you so many different directions, and you keep getting puzzled as to who to follow, what to do. And this is not just in like matching to residency. It's like residency, then fellowship, then green card, which is the problem you'll face as soon as you enter residency. So a quick comment on the J1 visa before we dive into the lessons from my journey. So all of you know that psychiatry has a pretty strong workforce in terms of IMGs. 30% of psychiatry trainees are IMGs. That number is decreasing now, given the decreased number of IMGs that match. And 25% of the membership of the American Psychiatric Association they belong to IMGs. Now, J1, let's clarify one thing. J1 research is separate. J1 clinical is separate. Both have separate amount of years you can spend here. J1 research, 5 years. J1 clinical, 7 years. Both are independent of each other. Once you complete your J1 visa, whatever your terminal degree is, you either go back to your home country for 2 years, or you can serve in a medically underserved area for 3 years. And most, if not all, people do get their waivers. If you don't get waivers, there are other options like O1 visa, but that is beyond the scope of this presentation. So going into the statistics, so this is what is happening. Number of US medical school graduates opting for psychiatry, if you see on the left side of the screen, from 2015, it was 957. And now in 2022, 1,640 US graduates and osteopathic graduates have matched. So the problem is, as the number of US graduates increase in terms of them matching to psychiatry, the number of IMGs goes down. So if you look at trends from 10 years ago, almost 60-70% of people matching into psych were IMGs. As of today, NRMP 2022 match, the right side of your screen, you can see that 2,047 seats. And if you're a US IMG, 188 is the number. And if you're a non-US IMG, 133 is the number of people who have matched. So you can see that the proportion of IMGs matching to psychiatry has significantly decreased. Now, another important thing is that most people are under the impression that US IMG includes US citizens and green card holders, which is not accurate. US IMGs only US citizen international medical graduates. Non-US IMGs is green card plus visa requiring people. Now, the problem is they do not give us the statistics separately for green card IMGs and visa requiring IMGs. So the problem is that 133 includes the green card holders, and we are not sure how many people among those are green card and how many are visa requiring. So that is a problem that we are trying to solve. We are trying to talk to NRMP to get those green card statistics so that it can give us a much better picture. Looking at the second graph, so this is NRMP 2022 match. Step 2 CK scores. As step 1 scores are out of the way for the most part. They'll still be in play given that old graduates have their scores, but CK scores will become more important. So if you look at the scores between like 181 and 190, you can see that 2 US IMGs have matched. And go all the way to the right, between 251 and 260, 5 US IMGs matched, but 2 did not match. When the same graph is extrapolated to non-US IMGs, which is the lower graph, you see that the people who have scores between 201 and 210, and all of them would fail the exam right now, if that is the score, if we consider it to be equivalent, which it is not. 3 people, even in that score margin, have matched. And if you go to 251 and 260, 4 have gone unmatched. So that tells us a very important thing, that even with a very low score, if you have a strong profile, you can match psych, even in this difficult scenario, and vice versa. If you have a 251 to 260 score, it's not 100% that you will match. However, if you have 260 plus, as per NRMB 2022, you will 100% match. So unless you have a 260 plus, there is no guarantee of your match just with scores. This is very different from internal medicine, where scores play a huge role. This is the graph from NRMB 2022, which tells us how many interviews you need to match, or what is your probability of matching based on the number of interviews. If you look at the left side, even if you have just one interview, both US and non-US IMGs, green is non-US, blue is US, is still 32%. Now to double that chance, so roughly going up to like say 64 to 70%, you need about 7 interviews for US IMGs. And if you want to reach that as a non-US IMGs, you need 9 interviews. And remember, this is a much steeper graph than internal medicine, which has way more seats. Psych had, as you saw, 2,047 something seats. Internal medicine has 9,000 something seats, and almost 50% of the people matching are IMGs. So that is why psych, compared to internal medicine, psych is much, much tougher to match. So yes, we did discuss it as difficult. So what we are doing is that at APA, we have created an American Psychiatric Association IMG work group, which is comprised of 10 people who are very passionate about IMGs and who are IMGs themselves. And we are trying to aggressively advocate at all levels to increase diversity, to increase the IMG numbers, to increase the seats, and to get the statistics of green card holders in the non-US IMG spectrum so that we can help IMGs to the best of our ability. This work group was just created this year. We actually have our second meeting tomorrow evening. I'm a part of that work group, and we are trying our best to help IMGs. Now, J1 versus H1 and its potential impact on the reduced numbers of IMGs in academia. So one issue that happens is once you complete your terminal degree, say you complete your fellowship, and you want to do a waiver, most academic places do not have waivers. Very few academic places like, say, Hopkins has a waiver. Some of the peripheral programs have waivers. Brown has a waiver. But other than that, most people eventually end up in places which are not academic in nature. And what happens is that leads to people just continuing in those jobs, not remaining in academia. And what that means is there are not enough people in academia to vouch for you when you are in a leadership position. So we are trying our best to see if we can change that, try to get more folks in the academic spectrum so that we can bring about a systems level change more than just like helping a few IMGs out. Okay, so all this stuff is beyond the scope of this presentation. Let's go to the next topic. So these are 2 math stories. I want you to comment in the chat section what would have happened to this IMG. So this is a US IMG 2022 match. At that time, while applying, the profile was step 1 of 205, step 2 CK of 215, CS cleared, step 3 203, no attempts, YOG of 2009. No electives, 5 years US clinical experience, out of which 2.5 was at an academic center in an inpatient unit, 15 publications, 2 interviews, has an MPH, and had applied 5 times before and went unmatched. So comment in the chat, how many of you think that this person matched or did he not? Can we see the comments or we can't?
I am looking. If they will comment, I will take a look.
Okay, till you think about it, let me give you a second story. So comment on both the stories. The second math story is non-US IMG, step 1 of 240, step 2 CK of 242, CS cleared, step 3 not given, no attempts. YOG of 2018, no elective, 6 months, pure hands-on USCE after graduation, no research, 8 interviews, no other degrees, and applied on time. Who do you think among these two people matched and didn't match?
Maybe I'm not able to see the comments, but
Let me see. I can see some.
can you see the comments?
I can't. I just see your comment, but I don't.
Yeah, so maybe they are just fascinated by the story. So
Okay. Let me. I think 2 people raised their hand, but let me. How do I remove this Q&A?
Q&A is separate, I think. Yeah,
No,
they put in their comments.
It is not. It is not.
Yeah, Q&A won't be removed, but if
No. I clicked on the Q&A. It is expanding the Q&A, but it's just showing me the Q&A. When I click it back, it's not going.
probably maybe we have to.
Let me just share again.
Maybe they are not able to comment. I don't know, but no, there is one new message. They're answering in Q&A. Okay, let me see. Oh, chat is disabled. I'm sorry, guys. For some reason, the chat is disabled. Oh, sorry. I guess so. They are asking in the Q&A. Story 1 will match is the answer. So sorry, everyone. You can ask in the Q&A. I think chat is disabled. So just put it as a question, and the other one says story 1 did not match. Story 2 matched. First unmatched, second match. So I think
mixed abilities. Right. So let's clarify certain things. Story number 1 matched. Story number 2 didn't match. So major difference, 2 major differences among these applications that were important. The person 2, and I see this very often, people with high scores in the steps, relatively fresher graduates, do not have step 3. Take it from me. I have been mentoring people for 6 years. I was the chief resident of my program for 2 years. I just finished my chief fellowship. I have reviewed every application in the last 6 years. I will tell you that step 3 is a very important screening criteria for most, if not all, IMG friendly programs. So if you have not taken step 3 now, ideally take the step 3 ASAP. And even if you cannot do it now before the application, get it in before December end. If you give it in January, the result will come in March. It's not going to help you. If you give it in December, the result comes in January, which will still help you with the rank order list. And remember, with the increased competition, you need that step 3 in. So lots of people who don't match, one of the main reasons is very simple. They have not just given step 3. So I have seen people with like great scores, even 250s, and have everything else in the profile. They have research, they have USC, step 3 is not there. And they go unmatched after 13 interviews, 14 interviews, 16 interviews. And then they seek help. And then they realize that one of the important things was step 3. I'm not saying it's impossible to match without step 3, but it is very, very difficult, even as a fresh graduate, to match without step 3. What did the first person do right is that we actually worked on this person for 1 full year, got him some good publications. So those 15 publications that you see, that was the main reason that this person matched. All the other things were pretty much red flags, but those 15 publications helped a lot in terms of strong networking with the program that person eventually matched to. So step 3. Please complete step 3 ASAP. Do not delay it.
So maybe Zeeshan, question for you. One question is coming up. Why did you do your MPH and how did you put this forward during the interviews? What is your advice to the recent med grads who are in MHA and preparing for USMLE?
Absolutely. We'll come to that in about 2 slides. So if you don't mind waiting for that, or are we out of time? Sorry.
No, that's fine. Take your time. That's okay.
Yeah, we can go to that. It's just coming in a couple of slides. We are going to discuss that. So before we go to that, do you need extensive research? Yes, we answered that question. So actually the slide came earlier than expected. So let me tell you this. So this is where I go when I always talk about like masters, PhD, all that stuff. But before that, look at point number 5. So US IMGs versus non-US IMGs, matched versus unmatched. Number 5, number of research experiences. And 6 is number of abstract presentations and publications. Number of experiences don't matter that much, but number of abstracts, presentations, and publications. Matched is 3.9 for US IMG, 9.1 for non-US IMGs. Research has been becoming more and more important. You need more and more publications. This number is going to get higher and higher every passing year. But come all the way down. So if you look at like 9 and 10, people who have PhD degree, people who have another grad degree, in the PhD degree, actually, 3.3 of unmatched US graduates had a PhD degree. And in the non-US IMG, PhD did help, 5.6 versus 2.7. But if you come to master's degree, any graduate degree, you see that it's like neck and neck, 29.6 versus 29.4 in US IMGs. Non-US IMGs is 27.5 and 30.6. So actually unmatched non-US IMGs had a higher proportion of having like another graduate degree. And that is the problem. Now, what I did was I initially came and did an MPH. So my MPH was not after my USMLE, it was before I gave my USMLE steps. The main problem that most people have is that they think that MPH as a degree or MHA as a degree is magically going to elevate their status in the match, which is not true. What you did in the MPH, how you utilized those contacts, how you made connections, how you networked, and how you used those 1 or 2 years that you spent during that master's degree, that is going to change everything. Now, programs do prefer MPH a little more over MHA because MPH, they think that it's not too far from medicine. You're studying the preventive aspect, you're trying to learn research. With MHA, the issue is that they think that you are trying to have a strong backup. You are just like migrating towards administration. So that is something that you need to address in the interviews, if not in the personal statement, if there's no space in the personal statement, that why you have decided to do an MHA. Are you trying to understand the administrative setup? Do you want to set up your own practice later? Do you want to help in the hospital administration? And how are you going to utilize the skills you have learned during your residency and fellowship? So that needs, even if they don't ask you the question, that has to be very strongly and properly explained. And that is going to help you. If you do not explain it and if they do not ask it, that is actually going to be a slightly negative point when they are deciding the match. Deciding the rank order list. So that is important. How I utilized my MPH was I made lots of good connections. And when I was applying for my fellowship, and they did ask me in depth about what I did in MPH, how I utilized it to do research. And the main attraction for Boston Children's Hospital and Harvard Medical School to take me were two things. One is definitely research. I had published extensively by then, and the publications have increased significantly since then. And then in addition to that, I had worked really hard in my residency and built up quite a profile in terms of like awards and like all kinds of awards, clinical leadership, research. So all that came together, but MPH did play a role. They were very interested in knowing how I utilized my MPH or what was the reason I did MPH in the first place. So that was one of the important factors in helping me match to an Ivy League in fellowship. So next, when to start? So some of the people who are attending this may not even have started research. They don't know what to do or where to do. So remember, you don't need a research position to get into research. You can always take online courses. The Sarthi has a course, Research Update Organization has a course, CIBMP has courses. There are free courses available on Coursera. Start learning about small things in research. Remember, you're not applying for a PhD program. You are trying to just show them that you have some additional skills in addition to your clinical work that will help the residency program grow. So simple things like letters to the editor, case reports, reviews, and then you go on to like original research, meta-analysis and stuff. But you do not need to wait till you have a research position. Get online, start working on it now. Even if you have nothing right now, there are lots of groups and lots of programs. My residency program has a research group that I started. It's been on for 2 years. Most of the people that match in psychiatry in our program in residency are from that group. In the same way, Larkin has a group, Bergen has a group that has their own research group. So when the program director sees you working regularly, there is a higher chance that you will match. So that is important that you start working now. And again, if you think that, okay, I have a 260, I'm going to match, I don't need research. Remember that if you are a visa requiring candidate, after you complete your terminal degree, if you do not have extraordinary qualifications, the wait time to get a green card under EB2 category, which will be your regular category, point of time is 151 years. So you will have to go to EB1 category, and for that, you will need research, if nothing else. So even if you have a 260 plus, I would start working on research right now. Because I can literally tell you, I have had 3 attendings call me last week. They are 8 years out of their fellowship, and they have not done any research, and they have now realized that they do not have the profile to qualify as EB1, which is extraordinary category. So they now need to work on research. So irrespective of whether you think you need research or not, you actually need research. So yeah, power in groups. So do not think that you are going to do it alone. That's not going to happen. create a group, working group, share data, share everything that you have. It doesn't matter which author you are. The point is to just publish more and more. Numbers are very important. Submit abstracts, do whatever you can, but do it in groups. Do not try to do it alone. Another thing, and this is more towards EB1, is the publications versus citations. So this is a residence like curve. Left side is publications, right side is citations. And remember that the 5th year is just half the year. So the PGY5 was just 6 months. So if you look at left, in PGY1 to 2017, 2 publications, no citations. In PGY2 2018, 5 publications, citations now go to 6. PGY3, 6 more publications, citations go to 36. Then 11 publications in PGY4, citations go to 54. And 6 months of 5th year, just 6 months. If we extrapolate it, it would be approximately in the range of 94 citations and for the whole year, and 12 publications for 6 months, or 24 publications. So as you see, these citations are important because lots of lawyers want 100 citations, 200 citations for them to file an EB1. So this is where you are. If you start today and get 2 publications this year, you might not have any citations this year, because to get citations, other people have to cite you, they have to get accepted, which takes 6 months, 7 months, 9 months, 12 months. So that is important. So start working now on your citations as well. Social media. Social media has become very, very important recently. And different kinds of social media give you different information. So first thing is Instagram. If you don't have an Instagram account, I would like you to go to Instagram today. And one important thing you can take from this lecture is create an Instagram account. All psychiatry, if not all, most psychiatry residency programs and fellowship programs are on Instagram, and they put out lots of good information about their residents, about what activities they are doing, when do they have open houses. So you can learn about the program, you can learn about the culture, you can see how strong they are. So this left side is HHS Psychiatry, which is Harvard Shoutsor, one of our residency programs at Harvard. Boston Child Psych Fellow is an unofficial Instagram handle of the Boston Children's Hospital Child Psychiatry Fellowship. So you can follow these 2, but follow all of them. You will get lots of good information that you cannot on an online interview. I put out lots of information. This is my handle, Zeeshan Mansuri, MD, MPH. Go follow that. You will get information about programs. You will get information about openings. You will get information about research. So this is some important information you can get. Twitter, 2 accounts to follow. One is definitely Inside the Match. It does something pretty similar to what I do. Puts out all the information about everything in general, like all open houses, all research openings or residency openings. So if you're on Twitter, Inside the Match is the place to go. Muna Telsam, right side. She was one of my students who met this year. She was an assistant physician. We'll talk about what an assistant physician is, but she posts some good stuff. And if you want to talk more in depth about what an assistant physician is and how you can get that, she's the one to talk to. And she's very good with responding pretty quickly to messages. So you can send a message to her. She just started her residency, I think at Missouri. Yeah. Facebook. So Pawan and I, we started this Facebook group. This is an old picture. Now it's almost 6 years. And we call it the USMLE Residency Mat 2022 and 2023 in loving memory of Dr. Shivani Bhatt. It's a sad story. You can look it up. So we have made sure that we delete as much spam as we can from this group and create this group where you can get all the information and you can ask lots of questions to each other. And this group has a pretty good number at this point. I think 129,000 or something is the number as of yesterday. Assistant physician. This is something that other people don't know. Assistant physician is not a physician assistant. So not the 27-month course. Assistant physician, which are also sometimes called associate physicians, are medical school graduates who have not yet completed residency training, something that lots of IMGs go through. So these licenses exist in Missouri, Arizona, Arkansas, Kansas, and Utah. Virginia is considering adding one. And you get a limited license to practice under supervision. And you have to be a citizen and within 3 years of graduation. That is for Missouri. For other places, you'll have to look them up. So 2 good things. One is you get the license, you get US clinical experience without paying for it. Lots of times you have to pay for it, which is a problem. And if you're within 3 years, just get this license. That will help you a lot in terms of like getting good LORs instead of doing observerships. So look up the websites of these places, see if you can get these licenses. If you meet the criteria, reach out to Muna. She had one of these licenses and she used it very effectively to match. Okay, fellowship before residency. So if you've completed a home country 3-year residency, not a 2-year residency, 3-year degree residency, not a 2-year diploma, it is possible that some fellowships that don't fill which is not very common. Normally, the places in the periphery don't fill, or some fellowships that people don't want, like geriatric addiction, don't fill that much, but it is possible. So the criteria normally is that you need to have at least 1 year of ACGME completed residency to match into fellowship. However, if the program cannot find a person who has completed at least 1 year, normally they're looking at someone who has completed the whole residency, but imagine that they are not getting that. So they try the criteria where they find someone who has completed 1 year of any residency. But if they can't find that, there is a provision that the program director can take someone who has extraordinary capabilities. So if you have completed step 3 and you have completed a home country residency, you can match into fellowship and then in a retrograde manner, match into residency in the same program. So if matching into residency is becoming difficult, matching to fellowship and then taking the retrograde route is sometimes advised, especially if you're an older graduate. And people have done it. So this is not just a theoretical thing. I personally know 4 people who have done it, and all of them are in residency right now after completing fellowship. So what on networking? Networking has become very important. So make sure you attend all, if not at least 3 to 4 conferences. If you can attend more, that's great. But at least ACAP, APA, at least the national conferences to build some good networks. Plan ahead. You're not just going there to have fun in the evening. But when you are there, make sure that you identify who you're going to talk to. Who are the people who are important? Who are the chief residents? Who are the fellows? Who are the PDs? Who is presenting what? How are you going to talk to them? How are you going to pitch your candidature? Do you have a 1-minute pitch that you have? Do you know when you will talk to them, etc., etc.? So don't just randomly go there and assume that you will make contacts. You have to strategically plan ahead and be open to having an open and meaningful conversation. So it should not be, okay, go ahead and you just try to pitch your candidature. It should be you first go ahead and talk to them about their research. And then after that, ask their permission if they are willing to engage in that conversation. And if they are willing to, why not? I'll give you my own example. During my fellowship application year, I met the Stanford's program director, and I had not still gotten an interview from Stanford. And I very politely asked him, first of all, I talked about his research, everything. And then I asked him that I have applied to the child fellowship this year, and I would like to talk to you about it. So is this a good time to talk? So he said he's busy, but he gave me his phone number and he said, tomorrow, let's meet for breakfast. And this is like a Saturday morning, last day of the conference. I go and talk to him for 1.5, 2 hours. And at the end, he's like, oh, you haven't applied to Stanford. So he didn't even remember why we were meeting. He liked me and he's like, okay, I haven't seen your application. I will go on Monday, first thing morning. I'll check your application and we'll go from there. He checks the application. And guess what? The reason I hadn't gotten the interview till then was Stanford needs very strictly 4 letters. Other programs need 3 letters. So that's why they had screened my application out. So now I directly get an interview and they just tell me to add a 4th letter. And Stanford was my second choice to match if I didn't get into Boston Children's. So this is how you can score big interviews if you are able to network. So that is important. Okay, so in spite of all these tough things in 2022, from the 133 non-US IMGs that match, these are some of the inspiring candidates. And I can proudly say all 5 of these were my students. Year of graduation of 1997, matched to a university program. Year of graduation of 2002, matched to a university program. Year of graduation of 2006 in her 8th math cycle, matched to a program. Year of 2012, 5th math cycle, matched to a program. Year of 2016, a Caribbean grad with 7 red flags, all red flags you can think of, matched. So yes, if you are willing to work hard, you can match despite the difficulties. So who can identify who this person is?
So maybe answer in the Q&A since chat is disabled.
In the Q&A, who can identify this person? Whoever identifies this person gets a free 1-hour talk session with me.
Aha. You're very generous with your time, huh?
I'm trying to get answers. Let's see. Can I see? I don't think anyone has answered. Okay.
No, not yet. Meanwhile, maybe you can answer a couple of questions that I've been summarizing.
I'm just finished. Like 1 minute is left, and then I can quickly go to the question. So this is Saul Levine. He is the CEO of American Psychiatric Association. And guess what? He is an international medical graduate, which very few people knew. So this is my last slide and my last message to all the IMGs. So you can do anything and be anyone you want to be, as long as you set your heart and mind to it. Reach out to people, ask for help, Once you are in a position to do so, return the favor and help others. Be grateful, gracious, and kind, not because you need something in return, but because you really mean it. Get out of your comfort zone. It might surprise you what you are capable of achieving. I was told before I even started the journey that I was never going to match. And I was told that I can never match to Harvard. And I proved both of them wrong. I had lots of failures during the way. It's not that I just magically matched to Harvard or magically got into residency. I had my phase of struggle as well. So sometimes you will fail and fall down. Who doesn't? Stand up with your head held high and try again. These bumps on the road are there for your own good. They build strength and character. Never give up. If I can do it, so can you. IMGs were, IMGs are, and IMGs will always be an integral part of the United States healthcare system. Thank you.
Well, thank you, Dr. Mansuri. Much appreciate, as always, very motivating. I think you're the flag bearers for the IMGs. So thank you very much for your time. Appreciate it.
Thank you so much, Pawan, for inviting me. It was a pleasure. And if anyone else has any questions, Instagram is the quickest way to reach me. Thank you.
Thank you. Thank you.
Bye-bye.